that there really isn't any moral or medical case now for requiring people to be jabbed to work in the front line of the NHS?
Well, I couldn't disagree with you more. Look, it was going so well. We were agreeing on so much. And then all of a sudden, what have you done? Look, I can't, I have to say, with all respect, I can't agree with you. I mean, first of all, where I think we do absolutely agree when it comes to vaccine mandates is that they should not be universal, as we are seeing in some countries in Europe and elsewhere. I think in general, for the population, it should be a positive decision that they choose to make with all the information available. But when it comes to people that are working in vulnerable settings with vulnerable people, the NHS, let's take that, or care homes, for example, it's about patient safety. That's what this is about. You know, you'll know already that if, for example, you work in the NHS, the General Medical Council, that's the regulator for doctors, it already requires doctors to be inoculated against a variety of diseases, hepatitis B and tetanus and many others. And COVID is no different. And what you've just said about COVID right now with Omicron, it's mild. Well, first of all, it's only mild if you're vaccinated. And if you're vaccinated, you're less likely to get it. Therefore, you're less likely to transmit it. But also, no one knows, and you don't know, Julia, and I don't know, what variant's going to come next. And there may be a variant of COVID that is not so mild, is much more severe. And when people are in hospital, you go to hospital to get better. You're already in bad shape. That's why you're in hospital. But you go there to get better, not to get infected when there was an opportunity for the NHS to limit that infection. It is the professional duty of every health worker to do all they can to look after their patients. 94.5% of health workers have already responded by taking the vaccine, and I'm sure that many more will.
So 94% of NHS workers who are double jabbed, and many of those will be triple jabbed as well. And yet we know that something like a quarter of cases of COVID in hospital are caught by people while they are in hospital. Should we not be focusing on protecting those in care homes, protecting those in the NHS, and those who are vulnerable and elderly, rather than mandating something against people? We were clapping for these people a couple of years ago, and now we're going to be sacking them, even though many of them will have had COVID. They've worked on the front line. There's no evidence that they are any risk to the people they are tending to. Is this really the sort of thing we want to be doing?
Well, first of all, there's lots of evidence, and you may well have people on the radio with all sorts of views to the contrary. But look, we live in a vibrant democracy. Everyone's entitled to an opinion, but an opinion is not a fact. Vaccines limit transmission. That's a fact, and the government should be led by facts, not by some.
But less so with that was certainly a good argument with them with other previous variants, but less so with Omicron, though.
Well, as I say, you're focusing everything on Omicron as though somehow that's the last variant of COVID. And I'm afraid I've got some news for you and your listeners that COVID is here to stay. There will be many more variants. I don't know what the next variant is going to be like, and nor do you.
Okay.
But it is right that health workers are responsible and professionally responsible, like the vast majority are, and they are encouraged to get vaccinated.
Okay.